So dear students, so today our topic is LFT, or also known as the liver function test, that can assess on the basis of the bile pigment metabolisms. Okay, so here we can perform the LFT. Okay, so whatever the intermediate compounds, so they are involved in the bile pigments. If any liver problems, so those intermediate compound, they are increases or decreases. Okay, so on the basis of the bile pigments metabolisms or assessing of the components, so those are formed in the during the bile pigments metabolism. So that was give one a clue. So regarding the scenario or working and status of the liver in our body. So that's why. So today our topic, that is the regarding the assess of the LFT through a bile pigment metabolisms. So these are the various tests through which we can diagnosis the, or we can signify the conditions of the liver. So that is the determinations of serum bilirubin, then determinations of urinary bilirubin, then determinations of urinary urobilinogen, then as well as the determinations of the fecal urobilinogens. So these are the metabolites. So those are produced so during the bile pigments metabolisms. In particular conditions, so these level was elevated or decreases. So on the, so these values, so when you are determined through a suitable method, so when you compare with the normal range, so then you can got the abnormalities. So through the abnormalities of these components regarding the serum bilirubin, urinary bilirubin, or urinary urobilinogen, and fecal urobilinogen. So if you estimated by suitable methods, so then you can got the LFT, or LFT can signified. You can know the scenario of the liver through a, so these tests. So now we can discuss one by one. So first we can discuss, or we can should we learn regarding the formation, excretions and fate of bilirubins. Okay, so already you will learn the same from the medicinal biochemistry regarding the synthesis of bilirubin. So once again I will be the highlighted. So regarding the formation, so how that was excreted and where that bilirubin can be modified or metabolized or turned over. So whatever these are regarding the fact of the bilirubin, so also studied under the through these slides. So dear students, so already you know, so RBC, so they having the an and average age is a 110 days. So after 110 days, the oxygen carrying capacity of RBC, so that was decreases, because each time the oxygen can enter into the RBC and exit from the RBC. In the lungs, the oxygen can enter. In the tissues, the oxygen can be exit. So due to these biochemical process or transports of the oxygen, certain oxidative process will be occurs. Okay, so due to that, the membrane permeability of RBC was changes, the structure is also changes. So that was considered as the aged RBC or old RBC. So old RBC, so they failed to fulfill the demand of the cells, but the God made certain system. So when the RBC structures was abnormal, okay, actually they are the biconcave or dumbbell shape, that was the beneficial for penetrations of the oxygen. Due to any generations of free radicals or entry of toxic substance or certain chemicals, these structures are altered. So those are known as the abnormal RBC or aged RBC after they cross the 110 days after synthesis. Okay, so these are breakdown through A1 system. So that system is known as the reticuloendothelial system. That is the RES, reticuloendothelial system. So this system was found in the liver itself and as well as in the spleen. Okay, So these are involved in these are having the mesh-like structure or arrangement of cells. So they allow the mesh-like structures having defined diameters to allow the entry of the RBC. So RBC diameter is, I think, that is 6.9 to 7.1 micrometer and average diameters. So due to irregular structure, so that diameter was increases. Okay, and these are that is the RES. So they are made up of certain pores. So with the help of the special type of cells in liver and spleen. So when the blood is passing through these pores, okay, when passing through the liver and spleen, so those diameter was increases regarding the RBC due to irregularity or age. So they are struck here and they are damaged or they are removed from the circulations by causing the destructions of the RBC. So their diameter is more than 7.1 due to age or due to any other drugs, entry of drugs or chemicals. Okay, so that was known as the breakdown of the RBC by a reticular endothelial system that was found in the liver and spleen. So that destruction of the RBC in liver and spleen responsible for the formations of the hemoglobin. So hemoglobin is the respiratory pigment or coloring pigment. So that was found in the RBC. So that hemoglobin is only it was play an important role in the transports of the oxygen. So that hemoglobin was released by a RBC in liver and spleen. That is the spleen. And further, so this hemoglobin are breakdown are separated where the heme part was separated and as well as the protein that is the globin part was separated. Same in the liver as well as in the spleen. That hemoglobin further it can be breakdown or destructed. It can separated into globulin and heme. So that globulin is nothing but is the proteins. So that protein is utilized by the liver synthesis of the new proteins or it is synthesis of the plasma proteins or synthesis of the it can supply to the RBM for synthesis of the RBC. So entire protein that is the globin. So that was reutilized for various metabolic functions in the body and remaining heme, that heme is also once again further it can be destructed. It was counted into iron and as well as the biliverdins. Okay, so that irons once again it can be reutilized by a RBM that was supplied by the liver and spleen that iron was entering the blood. From the blood that was reaches to the RBM, then the RBM it can utilize the organ, the iron and involved in the synthesis of the new hemoglobin molecules. Then this biliverdin it was converted into a bilirubin. So then the bilirubin secreted from the liver and spleen in the blood. Okay, that was transported in the blood. So by conjugations with the plasma proteins like a albumin and globulins, it can bind with the or with the help of the plasma protein. So that bilirubin was transported or recirculated in the blood. So whatever the bilirubin, so that was released from the destructions of the heme, that bilirubin is transported in the blood or plasma. So that bilirubin is known as a unconjugated bilirubin. Okay, so this unconjugated bilirubin, so that was a insoluble in water. It is a completely insoluble in waters. So from the blood, so once again when that blood which vegetate to the liver, so liver can uptake the bilirubin, especially the hepatic cells. So they are reuptake the bilirubin, that is unconjugated bilirubin from the blood. Okay, so when that blood will be revegetated to the our liver or liver cells. Then were in the liver cells, so that bilirubin it can conjugate with the glucuronic acid. Okay, it can re-enter into liver. Okay, so that can be conjugated with the glucuronic acid. So whatever the bilirubin, it was conjugated or combined with the glucuronic acid. So that bilirubin is known as a conjugated bilirubin, it is a soluble in water. Okay, so it is insoluble in water. That's why it is not found in urine. And this conjugated bilirubin is soluble in a water. So that's why. So that was found in the urine. Okay, that was the traces amount. And that conjugated bilirubin from the liver, it was secreted into our intestine. So that conjugated bilirubin, it was stored in the gallbladder through a biliary duct. So biliary duct, so they are arise from the liver and supplied to the gallbladder. So that was helpful for the passage of the conjugated bilirubin from liver into the gallbladder. And that gallbladder, it was secrete the bilirubin into the small intestine in a duodenums. Okay, in the duodenum, it was secrete the bile, so that contain the conjugated bilirubin. So that secreted conjugated bilirubin, so that 50% of the conjugated bilirubin, so that was reabsorbed or re-enter into liver through a portal circulations, then enter into liver once again, so that is become the part of bile, then it was secreted through a bile into intestine. So like that, the 50% that was secreted in the small intestine, that was reabsorbed, re-entered into liver and reutilized and re-secreted. So like that, this process will be going on, so with the help of the healthy livers. Okay, so remaining 50% the conjugated bilirubin, so that was converted into urobilinogens. Okay, so that was counted into a urobilinogen. Okay, so by a intestinal bacteria, so that bacteria was mainly found in the bacterial flora. So bacterial flora is present in the large intestines. So that large intestinal bacterial flora, it can convert remaining 50% of conjugated bilirubin into a urobilinogens. So that urobilinogen is formed in the large intestine. Only 5% of urobilinogen, so that was secreted through a kidney. Only small amount of urobilinogen, so that was secreted through a kidney, and remaining maximum amount, so that was secreted through a feces as a streakobilinogens. So that was secreted through our feces, that was in the form of the, that was counted into a further sterobilinogen. So like that, the whatever the bilirubin is formed from the aged RBC, okay, so that was is excreted or metabolized. So like that, okay, so that was converted to conjugated bilirubin, so then converted into that is sorry, it is the unconjugated bilirubin, then what is converted to bilirubin from bilirubin, that was known as the unconjugated when it is present in the plasma. So when it is conjugated gluconic acid, so that was known as the conjugated bilirubin. So then it was secreted to the intestine, 50% reutilized, recirculated, remaining that was converted to urobilinogen, that is the 5% is secreted through a kidney and remaining secreted through the feces. So that's why the estimations of the or determinations of the unconjugated bilirubin and conjugated bilirubin, as well as that is the urobilinogen in the kidney or urine, and urobilinogen or stercobilinogen, it is the form of urobilinogen through if in the feces. So that was helpful for to assess the functions of the liver. Okay, that was helpful for to assess the functions of liver. If the liver is healthy, okay, if the liver is healthy means definitely the unconjugated bilirubin will be reutilized. That was secreted in the converted into conjugated bilirubin, so that was very well managed. Okay, if the liver is under the malfunction, okay, so any problem between the liver and gallbladder, because the conjugated bilirubin that was stored in the gallbladder, that was synthesized in the liver, that was reutilized by the liver through a portal circulation once again it can restored in the gallbladder. Okay, if if the conjugated bilirubin in the blood is increases, because it is not increases in the healthy human. Okay, if it is any liver is problem or any problem in the passage between the liver and gallbladder, what are the duct are present between liver and gallbladder, if any struck due to some gallstones or any problems, so then what happens, so this transport system was blocked, so due to that in the blood the conjugated bilirubin is increases. If it is increases means, so that was helpful for to denote the, so there is a problem in the biliary duct, or there is a obstruction in the bile flow, so that's why that was not secreted very well in the intestine, so due to that in the plasma, so that level was increases. Okay, if suppose the unconjugated bilirubin level is increases, but conjugated bilirubin is normal, it was not increases, but unconjugated is bilirubin level is increases more than normal, but conjugated bilirubin level is the normal, so that indicates the liver is healthy, but the RBC are more ruptured due to any viral infections or due to any genetic infections or certain problem in the spleen, so that can destruct the more RBC, even healthy RBC, so that was destructed due to use of drug, chemicals, sickle cell anemia, thalassemia, many other conditions are there. So okay, so where the more RBC can be ruptured, hemolysis occurs, so that's why, so the more bilirubin produces, so that's why the unconjugated in the bilirubin in the blood that was increases, but unconjugated that was not increased, because it is increases definitely step by step, that was utilized by the reuptake by the liver cell and involved in the process of the conjugated bilirubin. So like that, by targeting the unconjugated bilirubin, then conjugated bilirubin, then urobilinogen in the urine and as well as in the feces, so that was helpful for to assess the functions of the liver or associated disorders mainly. So these unconjugated, conjugated urobilinogens and sterobilinogen, they are used for to differentiate the different type of the jaundice. So they are helpful for to differentiate the obstructive jaundice, hemolytic jaundice, and as well as the hepatic or any other jaundice. So that was differentiated with the help of by monitoring the unconjugated, conjugated or urobilinogens in the eating. So in the next, so we can learn regarding the Weinberg test for bilirubin. So it is one of the standard test. So this test is commonly used for qualitative and quantitative estimations of the bilirubin in the serum. Also, the same phenomena was employed for assessment of the urobilinogen in the urine as well as in the fecals. So dear students, so this Van Denberg test or Van der Berg reagent, it consists of the two component. One is the sulfonic acid in hydrochloric acid and as well as sodium nitrate. Okay, so these sulfonic acid and plus sodium nitrate are known as a Vandenberg reagent. So that reagent, it can react with the bilirubin. It can use the purple color. Okay, it can use the purple color. So when the Vandenberg, it can interact with the reacts with the bilirubin. This is the principles of the Vandenberg test. So it consists of the sulfuric acids and as well as sodium nitrate. So when you are added in the serum, so it can react with the these bilirubin and it can use the purple color. So purple color is the end point. So that was helpful for qualitative as well as the quantitative estimations of the bilirubins. So already you know, so regarding the conjugated bilirubin, it is the process of the bilirubin by a liver by uptaking the after uptaking of the unconjugated bilirubins. So this conjugated bilirubin, it can react with the Vandenberg reagent Okay, so it can produces the purple color within 30 seconds in the shorter time, within 30 seconds. So when your serum is mixed with the Vandenberg reagent, means within 30 second fractions of the second the purple color is produces. By observing the intensity of this color with the help of the colorimeter, it can use the how much amount of conjugated bilirubin so that was present in the serum. Okay, it is present negligible, definitely give the purple color, but intensity of the purple color when you monitor by the colorimeter, with the help of colorimeter, that you can use the how much amount of bilirubin, conjugated bilirubin, so that was present in the serum. Okay, so when the Vandenberg reagent, it can give the purple color, it means it can interact with the conjugated bilirubin within 30 seconds. So this step of the Vandenberg reaction is known as the direct positive Vandenberg reactions. It is helpful for the diagnosis of or presence of the or determinations of the conjugated bilirubin in the serum. But if conjugated bilirubin is normal but unconjugated bilirubin is more due to any problem in the liver, spleen, or due to more hemoglobin destructions, so on that time the unconjugated bilirubin level is increases. Okay, but immediately within 30 seconds, so this unconjugated bilirubin that was in solvent water do not give any color. Okay, so when within 30 seconds if the purple color is not produced, then you can add the methanol. Okay, so then you can add the methanol. So in the presence of the methanol, so that serum color was changes to the once again purple color. So within 30 minutes, not a 30 second, within 30 minutes, by additions of the methanol or alcohol, the serum color that was changes to the purple color within 30 minutes. If the within 30 minutes the purple color is appears in the presence of the alcohol, it means it is a indirective positive reaction or indirective positive Vandenberg reaction. So it is gives the purple color if unconjugated bilirubin is present in the our plasma or blood. So once again intensity of this color is monitored by the colorimeter, that can give the how much or concentrations of the unconjugated bilirubin from the blood. Okay, so that is known as the indirect positive Vandenberg reactions. Okay, and third note of the this reaction is or this test is that is the biphasic. Okay, so in this case, so when you are adding the Vandenberg reagent, immediately it can give the purple color within 30 seconds. Then after that, if you are adding the in the purple color, if you are adding the methanol, means that purple color is disappear. Then after within 30 minutes, okay, after 30 minutes, once again the purple color is increases. It means it can use the both test positive, direct as well as indirect. It means it can confirm both conjugated and unconjugated bilirubin that was present in the plasma or serum. So that phasic reaction is known as the biphasic reaction. So these three reactions, so that was helpful for the are helpful for the differentiations of the different types of the jaundice. Okay, so that will be the learn in the, you should be remember these points. So when the direct positive is produces within 30 seconds by additions of this reagent. Okay, so due to presence of the conjugated bilirubin, and unconjugated bilirubin it gives the purple color by additions of the methanol within 30 minutes. So that is known as the indirect positive. When biphasic means immediately produce purple color, so that was disappear. Then after additions of methanol, once again the integrations or integrity of the color was increases. In the both time it can show the direct positive as well as indirect positive. So that phase of this Vandenberg reaction is known as the biphasic Wendy-Berg reactions. Okay, so here once again we can highlight so how this test was helpful for to significance the various type of the jaundice. So already you know the bilirubin is mainly two types. So that is the unconjugated bilirubin that was freshly RBC was ruptured, then bilirubin is converted into bilirubin. So that is known as the unconjugated. So the normal range of unconjugated bilirubin in our serum is 0.2 to 0.9 mg per deciliter. That is a 0.2 to 0.9 mg per deciliter. It is the normal range of the unconjugated bilirubin. And conjugated, it is soluble in water, then the ratio is 0.1 to 0.4 mg per deciliter. But total bilirubin, okay, so that is the total bilirubin, so it is the 0.22, that is 0.8 mg per deciliter, or in some book they are mentioned 0.5 to 1.5 mg per deciliter. It is the okay. So that total bilirubin is the summations of unconjugated plus conjugated bilirubins. If you can got the direct positive, only additions of Vandenberg reagent, if you got the purple color means, so then it can indicate, then monitor the concentrations of the bilirubin. If it is more means more than this value means that indicates obstructive jaundice. In the case of the obstructive jaundice means, so there is obstructions in the bile flow, okay, from liver to the gallbladder. So due to obstruction, so that cannot supply to the gallbladder, cannot stored in the gallbladder from the liver. So that's why, so this level was increases in the plasma. So where it can show the direct positive. So that was helpful for the obstructive jaundice. So that jaundice is occurred due to gallstones or cancers of biliary system and pancreas. If your test was shows the indirect positive only, so that was denotes the hemolytic jaundice, that is the excessive destructions of the RBC. Due to that, the unconjugated bilirubin is increases, but conjugated bilirubin level do not increases. Only unconjugated bilirubin level increases more than the normal. So that is due to renal disorder, hypersplenisms, burns, malaria, sickle cell anemia, thalassemia, drug and chemicals, and autoimmune disease, where the destructions of RBC, the hemolysis of RBC will be the more. So due to that, the concentrations of unconjugated bilirubin through a Vandenberg reagent test that was shows increase in the value, that was helpful for the diagnosis of hemolytic jaundice. If in the both cases shows the positive, that positive is also there, or during the indirect positive also the purple color is produced. So that was known as the biphasic. If the reaction shows biphasic responses, it means that candidate was suffering from the hepatic jaundice, that is the damage of the hepatic cell. That is the damage of the hepatic cell. So where it can show the total bilirubin level, so that was increases more than 0.5 to 1.5 mg is the normal. So if it is more than that, it indicates that candidate was suffering from the hepatic jaundice. That is the damage of the hepatic cells. So due to there is infections by virus or alcoholic hepatitis, cirrhosis of liver, and exposure to the toxic materials. So like that, the direct bilirubin and total bilirubin that was determined through a Vandenberg reagent test. So that was helpful for the differentiations of the jaundice. It is differentiated as obstructive jaundice or hepatic jaundice, or it may be hemolytic jaundice. Liver is healthy, but the destructions of RBC will be more. So like that, the jaundice are mainly three types: obstructive, hepatic, and hemolytic. So they are differentiated. So with the help of the estimations of the direct bilirubin and total bilirubin. So that was helpful for to assess the liver functions. If you want to know the scenario of the spleen, or that was the diagnosis of hemolytic jaundice, then it was helpful for the through the estimations of the unconjugated bilirubin. So like that, so these three factors they are helpful for the differentiations of the different types of the jaundice. So next one is the urinary bilirubin. So normally, so urinary bilirubin is absent in urine because unconjugated bilirubin is insoluble in water and it is always absent in the urine. But conjugated bilirubin, so that being the water soluble, so that's why it was excreted through the urine. So in the case of the obstructive jaundice, so the unconjugated bilirubin level excretion is increases if it is more than 5%. Normally only 5% of the conjugated bilirubin in the form of the urobilinogen, so that was excreted. If it is more than that, so that can denote the person was suffering from the obstructive jaundice. So urinary bilirubin was estimated by a deep stick methods. So this is the procedure. So once again, by following the utilizations of the principles of the diazo reactions or eco test tablets. The normal range of the unconjugated bilirubin urine is that is 0.002 mg per deciliter. If it is more than that, that indicates that person was suffering from the obstructive jaundice. So next one is the urinary urobilinogen. So this is the converted product from the bacterial flora, only 5% that was excreted through the urine, but normally a small amount, so that was present in the urine. So in the obstructive jaundice, the bilirubin is present while urobilinogen is absent in urine because so that unconjugated bilirubin, when it is converted into bilirubin, okay, so that cannot be converted enter into a intestine and cannot be converted into urobilinogen. So that's why only in the urine the bilirubin is present and urobilinogen is absent. So that can denote the person is suffering from the obstructive jaundice because in the case of the obstructive jaundice, bilirubin cannot be secreted into intestine due to problem in the transports of the bile from liver into the gallbladder due to obstructions in the biliary flow or biliary ducts. Then in the case of the hemolytic jaundice, the bilirubin is absent, but urobilinogen is more present in the urine because more hemolysis occurs and more conjugated protein is the conjugated bilirubin is forms and that was more secreted in the, that is the intestine, and that was converted into more urobilinogen. So due to more urobilinogen conversions, that level in the urine is also increases due to more hemolysis or destructions of RBC. If it is more present in the urine, that can denote the person was suffering from the jaundice. So here the Ehrlich's test, so that was helpful for the diagnosis of the urinary urobilinogen in the urine. So then these are the various reagents. So they are used by this procedure and the end point is the pink color. So by measuring the intensity of the pink color through a colorimetry, it can give the how much amount of urobilinogen so that was present. If it is present, then it is indicates hemolytic jaundice. If it is not present and bilirubin is present, that indicates obstructive jaundice. So like that, obstructive hemolytic jaundice, that is also differentiated or to know the scenario of the liver with the help of the urinary urobilinogen. So next one is the, that is the fecal bilinogens. So maximum amount of the urobilinogen, so that was excreted through the feces. Okay. So the normal range is that is the 50 to 250 mg per day. It is also helpful for to differentiate the hemolytic jaundice and obstructive jaundice. In the case of hemolytic jaundice, the fecal urobilinogen is increased, which is a dark color. So more ruptures, so more urobilinogen forms and more our feces color become the more dark. So that indicates the more RBC was ruptured in our body due to hemolytic jaundice. In the case of the obstructive jaundice, the fecal urobilinogen is decreased or absent because so that conjugated bilirubin cannot secreted into the intestine. So that's why it is less amount, so that was present in the feces. So that indicates where the color of the or feces become the pale or clay colored. So that indicates so the person was suffering from the obstructive jaundice. If the complete absence of the fecal urobilinogen shows the malignant obstruction. The gallbladder was suffering from the cancers, or bile duct, they are suffering from the cancer. That was known as the malignant obstruction. In the case, decrease may occur in the extreme cases disease of the hepatic parenchyma. If the person suffering with hepatic parenchyma, then also this level is increased. So this was diagnosis with the help of the, once again, the Ehrlich reactions by using the paradimethylaminobenzoaldehyde and ascorbic acid. The end point is a certain color, like a dark color or clay color. So that was helpful for the to know the senior of the liver through a metabolites of the bile pigments.